Hi everyone, we're Team 5, the quarantine. So COVID has taught us many important lessons and we reflected on some of these problems from COVID-19 to create 5 actions to prevent the next pandemic, which are centered around equity.
Global Committee. Currently, there's no organized global group to respond to disease outbreaks. This means these organizations slow respond, and some countries are left behind, particularly low-income countries. They have less healthcare and research to prevent spread of disease, leading to disproportionate impact. We propose one trusted global committee which coordinates and facilitates responses at the national and international level. This allows open communications between nations. This would work well because a quick response can be initiated, making it less likely for an outbreak to become a pandemic. The solution is equitable because first is advocate for low-income countries on an international platform. Secondly, there's oversight of national responses, particularly in countries of corruption. Thirdly, there's increased resource sharing between rural and urban areas and between high-income and low-income countries due to coordination of resources.
Bottom-up communication. In this pandemic, there was distrust in government, which led people to find alternative sources of information, leading to misinformation. This issue is particularly prevalent in countries where corruption is perceived to be high or within marginalized communities where previous harm was done, such as colonization and oppression. Misinformation can cause mass hysteria, leading to public health guidelines to not be followed, causing widespread infection. Our intervention is a grassroots approach whereby you can appoint trusted community leaders. They will receive evidence-based information while also voicing concerns of their people to authorities. This builds trust between communities and government, leading to better adherence to health advice and stopping the spread. This is equitable because it is a transparent two-way communication between marginalized communities and government. It gives a voice to communities who don't have the representation and higher power to have their needs heard. Increased trust means more access to healthcare and therefore better outcomes.
Top-down communication. Another problem is the contradictory information about health from many sources. This often means people resort to easily accessible but unreliable sources like Facebook or simply remain uninformed or confused. Our solution is to have one common domain where everyone gets verified, easy to understand information. This is delivered through multiple mediums such as in all-inclusive app, radio, even physical booklets, all of which have shown to work in different ways. This is a readily accessible open line of communication globally and nationally, which reduces confusion and makes it more likely that people follow health guidelines. This is an equitable intervention because everyone will have at least one way of being able to access reputable information. Furthermore, it helps increase population health literacy, which is often a barrier to adhering to public health guidelines.
Another international problem is the shortage of healthcare workers. This leads to disparities between areas with lots of resources and those with less. For example, urban versus rural areas. We propose optimizing the workforce and building institutional capacity and partnerships. For example, combining the military with healthcare. This would mean that nurses, for example, can take more of a leadership role while also educating the military with basic health skills and health coaching. This better utilizes current resources to prevent healthcare system from being overrun. This is equitable because it increased the numbers of workers and the access to healthcare in under-resourced areas. Like military planes can be used to reach rural or remote areas. Therefore, this could improve working conditions and retention rates for healthcare workers because workload is spread across more people and the workforce gap in lower income regions is avoided.
With regards to monitoring, often diseases take time to be recognized and thus longer to create treatment options. This is because there's no fast way of monitoring diseases or categorizing them efficiently, which delays research. This is often the case when diseases emerge in remote areas where access to healthcare research facilities are low. Creating an open source monitoring database using previous interventions such as grassroots level networks to flag new diseases in combination with a global committee to promptly respond by sending out a member to the site. A retrieved sample will then be made available on an international resource platform for global collaboration and response. Higher income countries are more prepared to respond to disease treatment plans in comparison to lower income countries. The Zika virus with no vaccine yet and Ebola, which took 42 years for successful clinical trials to occur, are evidence of this. Regular monitoring allows for equity in response time and treatment between high and low income countries.
Thank you for listening.